I'm Dr. Chen Wen Liu from Orthopedics 360. I've just made this short video just to go over some of the pre-operative things to expect before we meet each other on the day, and just to run you through a few of the sequences and procedures for the upcoming operation. The first thing is just to make sure that you've received all of your paperwork. Now, normally we send these out approximately 3 weeks before the surgery. This includes instructions for when and where to have your blood tests, your ECG and your urine test. Apart from this, you would have already had instructions to stop some of your medications, and this includes the anticoagulant medications. It's really important that if you have already been on an anticoagulant such as warfarin, Xarelto or clopidogrel, that you've gone through a specific plan for when to stop those. Typically, in most cases, we like to stop all of the anticoagulations before surgery, and that includes glucosamine, fish oil, garlic, ginkgo, and any other supplementation that may cause increased bleeding risk during the surgery. If you're unsure about this, we do have some information on our website, but also please feel free to contact us to go over these details. The day before surgery, you'll receive your finalised time for admission. This means the time for when you arrive at the hospital. Now, if you have already arranged transport, please make sure that you arrive at the hospital at this time so that we can ensure that your admission goes according to plan. It can take roughly 60 to 90 minutes to get you admitted through the hospital. This starts by attending the front desk at the hospital and advising them that you've arrived. A series of paperwork requirements will occur in addition to an armband or wristband that's placed onto your wrist, which includes your name, date of birth, and a hospital ID number. Don't worry if you're asked these numbers multiple times, because we will ask you your name and date of birth many times throughout the course of your admission in hospital, and that is completely normal and just part of our quality assurance. After you've been admitted, you'll move to a holding area. In that holding area, please feel free to bring a magazine, a book, or some music. You'll spend some time here waiting to be brought through to the operating theatre suite, at which point my anaesthetist and I will catch up with you before the surgery. At that point in time is your opportunity to go over any last concerns that you have, but also it will allow me to double check all of the details that we've gone over before the surgery. We always double check your name, date of birth, the side and the procedure, as well as any allergies that you've had. If you have had any change to your medical circumstances, please let us know in anticipation of this, or let us know on the day just before you see us if it's nothing too major. At this time, we wheel you through for your spinal anaesthetic. Now, the spinal anaesthetic is how we like to do the majority of our anaesthetics for our hip and knee replacements. When you have a spinal anaesthetic, you'll be placed in an upright position, leaning over a pillow. You'll be given some very light medications so that you are really relaxed for this, and you'll have an easy time to have this procedure done. After that, wheeling through to the operating theatre, where I'll see you again, and we'll talk a little bit about the procedure just before we come into the theatre complex. Now, in the actual theatre room, it can be a little bit noisy. We are preparing for your surgery and have been doing probably for about 20 to 30 minutes before you arrive. This includes ensuring all of the equipment is available and ready to go for the operation. When the operation time comes, you'll be placed across to the operating table. You probably won't remember much of this, and you certainly will be very comfortable during this process. You may notice that your legs are very tingly at this stage, and that is a fantastic sign. Once the operation has been completed, you wake up in the recovery room. You'll spend roughly 30 to 60 minutes, and sometimes a bit longer, in recovery, just while we wait for the spinal block to wear off slightly. Now, we like to ensure that the spinal block drops a few levels before we let you safely go through to the ward, and that's to make sure that there are no issues or complications with the spinal, which are extremely rare. At this point in time, you're free to have visitors, and certainly it is advisable for your visitors to call the hospital first to ensure that you are out of recovery before they come to visit. Occasionally, you might have a longer stay in recovery if the spinal takes a long time to wear off. If your operation has been performed in the earlier part of the day, then most certainly we'll be attempting to get you up and walking the same day of surgery. It is normal for there to be a little bit of variability with this, where a lot of our patients will be able to mobilise on the day, whereas some who might feel sick or have low blood pressure may want to stay in bed that night. You haven't lost anything if you don't get up to mobilise that first night, but it certainly helps to speed up the recovery process. Once you are through with that, please check your phone. I normally will send you a message just to let you know how everything's gone with the surgery after you wake up. Once you've received this, there's no need for you to rush to review this. It is something that you can review over and over again at your convenience later in your recovery. I'll see you the following morning to go over how everything went again and to ensure that you're feeling very comfortable and to double check everything that you may need to ask me at that point. You'll spend roughly 2 to 3 nights in hospital, and we certainly can let you go quicker or keep you longer, just depending on how you progress through your hospital stay. On the day of your pickup from hospital, we generally advise people to be picked up around 10 a.m. in the morning. That gives us enough time in the morning for us to have that final physio checkup, the medications from the pharmacy to be arranged for you, which includes some of the pain relief that you may receive, and some instructions from our team on how best to look after the wound as well as look after yourself over the course of the next couple of weeks. The following couple of weeks you'll spend icing the leg, particularly in the thigh muscle, which tends to swell up regardless of whether you have a hip or knee replacement, and then spending the time to do the gentle exercises over the course of that time. You aren't required to do any strenuous physiotherapy during the first 2 to 3 weeks after surgery, with the main focus of hip and knee replacement recovery on swelling control during that time. I hope this video has been helpful for you in outlining some of the procedures and sequence of events that occur after and during your surgery. If you have any questions leading up into the operation, please don't hesitate to contact me or the rest of the team. Otherwise, I look forward to seeing you on the day. Thanks for watching.